Tonight, our guest speaker is Dr. Vic. He's with the AllCure. It's a spine sports medicine. Okay. It's a sports medicine and spine facility right here on Canal Walk Road. And Dr. Vic. Yeah.
Right. Good evening, everyone. Appreciate you guys having me here. So my name's Dr. Victor Alfieri. I'm a local business owner, a small family practice owner right here in Somerset. I've been in business in Somerset for about 1 year, and I'm a doctor of physical therapy. And today I have a really informative and educational presentation for you guys on a really important topic as it pertains to seniors. And so it's going to be about 20 to 30 minutes. I'm going to go over some really important topics, how to keep you guys safe on your feet, talk about balance, posture, some strategies you guys can use to prevent falls, which is a really important topic, as I said, as it pertains to seniors. And then at the end, we'll do a little bit of like question and answer. And I have some merchandise and things. If anyone wants to help themselves after the presentation or has any questions after the presentation, I'd be happy to answer. Okay, so again, I'm Dr. Victor Alfieri. So again, we're going to be talking about fall prevention and body mechanics as it pertains to seniors. So moving forward, go ahead, Bruce. Okay, so we're going to talk about a lot of different things, strategies to prevent falls, keep you guys safe on your feet. It's a very important and common topic. So we're going to talk first, 5 principles of fall prevention. Okay, so my favorite one as a doctor of physical therapy is going to discuss exercise and balance, right? Exercise and strength training. As you age, it's so important. There's a lot of new research coming out that talks about strength training and exercise and how it adds to longevity in your life, good quality of life. It's good for your mind and your body to keep yourself moving, keep yourself strong, keep yourself exercising, and work on your balance, okay? So exercise and balance is the first topic. Then reviewing your medications. Oftentimes how medications can mix together, whether it be blood pressure, pain medication, the way that these medications mix together in your body can put you at risk for falls, okay? The next one is having your vision checked. You rely a lot on vision for balance, right? So oftentimes in my clinic, I'll have people do like eyes closed balance training, and they get so surprised at how just closing your eyes can really throw off your equilibrium and balance. Next, wearing supportive shoes. You know, obviously not walking around in flip-flops or having some good supportive shoes. Oftentimes Medicare will cover supportive shoes that can really help, you know, give you that extra support, keep you safe on your feet. And then finally, having a safe living environment, right? Keeping things clean, no carpet, throw rugs, you know, no slippery floors, things like that in the bathroom. So we're going to dive into these topics in a little bit more detail. But I always like to show this stopfalls.org. Okay, stopfalls.org is a great tool to kind of get a little bit more information as far as some of the things that I'm going to talk about today. Stopfalls.org and really help kind of hone in some of the topics that we're going to cover here. Okay, go ahead, Bruce. So first, let's talk about the risk factors for falls. What puts people at risk for falls, right? Obviously, as you age, it becomes more and more common that people are suffering from falls. So environmental safety, making sure that, you know, your grandkids' toys aren't all over the floor, that you're keeping your living environment safe, that you have adequate lighting and things to put yourself at a good advantage so that you're not putting yourself more at risk from suffering a fall. Having a medical history of falls. Research shows that 60% of people over the age of 65 suffer at least one fall per year, which is quite an alarming statistic. 60% of people over 65 will have a fall, right? It's quite common. nothing to be ashamed about, but there are things that you can do to prevent yourself from having a fall, or if you have had a fall before, you're even at more of a risk of having another one. Okay, so having a medical history of falls really puts you more at risk there. Having muscle weaknesses and imbalance, right? If you have stenosis in your lower spine, neuropathy in your legs and feet, you have, a knee replacement on one side and then the other side is a lot stronger or something like that. Having these sort of muscle imbalances and weaknesses within your body can put you at more of a risk for falls, right? Then vision, right? So making sure that, you're being checked for cataracts, you're getting your yearly checkup with your optometrist, any sort of glaucoma, things like that, that'll put you at a big risk as well. Balance and mobility, again, my favorite kind of one where, just as you would do curls to strengthen up your biceps, training your balance and doing exercise for your balance is something that you can strengthen as well. So if you are using the gym here in the clubhouse, or you are going on walks, try to mix in a little bit of balance training, which is what we're going to talk a little bit more about, so that you're keeping those balance muscles strong and having your brain communicate well with your legs, your feet, your muscles, right? Next, we talked a little bit about multiple medications, how they mix together. If you've ever been, sitting down for a long time or lying down in bed for a long time, and then you go to get up and you're like, you get that moment of, where you're feeling like you're going to fall, or you get that quick blood pressure drop, right? You always want to take the extra time if you've been lying or sitting down a long time to kind of get your bearings, get your equilibrium before you start moving. I've seen it many times where people are sitting a long time, they go to get up, they get a little bit of dizzy, and then they're on the ground, right? So obviously that's important too with medications. The fear of falling, right? So fear of falling is definitely a real thing. If you've had a fall before, you're grabbing onto furniture as you pass by things, or you don't want to go out into that tonight's men's club meeting because you're apprehensive about falling. That's a real thing, but sometimes it can cause more harm than good. My grandfather, he loved going to Atlantic City, loved every weekend. He'd be on the slots. It's like what he would always talk about. But then he had a fall in the middle of the casino. And then after that, never wanted to go back. And then it affected him a lot. And I think it was a big reason why he really slowed down later in his life. So obviously keeping in mind some of these things, not having such a fear of falling can be a good thing. And then finally, alcohol. As we know, that can put you at more risk for falls. That doesn't need too much explanation. All right, so go ahead, Bruce. Okay, so we talked a little bit about this fear of falling. It usually worsens after the first fall. It can cause depression, as I saw within my grandfather. Things really slowed down, didn't do what he was enjoying, didn't want to get out in the community, didn't want to go out socially with his friends, or in his clubhouse community that he lived in. So it also can weaken your muscles as you become less active, right? You'd be surprised how much just getting up, getting out of bed, going through your daily routine doesn't necessarily need to be like going on a long exercise walk or doing any sort of training. Just your day-to-day stuff keeps your muscles nice and strong, right? So if you're becoming less active and you have this increased fear of falling, you're going to notice that your muscles start to waste away, right? If you've ever, seen someone have a surgery, they were in bed for 2-3 days. After that, the muscles just shrink like this because they weren't doing their day-to-day tasks that they're accustomed to be doing. So also it can affect your balance, having this fear of falling, right? You start to kind of, shorten up a little bit. You get a little bit of like a shudder in your step length and your strides, right? And then your social and recreational activities decrease. And then you have this kind of increased apprehension, right? You're, again, grabbing onto furniture, or you're kind of closed off when you're walking, right? Sometimes these things can cause more harm than good. All right. Go ahead, Bruce. We'll talk quickly about assistive devices. I always say there's nothing to be ashamed about using an assistive device. If it's going to keep you from falling, then definitely go for it, right? So like I said, it's so common that people are falling, more common than you probably would even think. So, if you have had a fall, if you feel like your muscles are, getting weaker and you're not stable on your feet and it's affecting your day-to-day, whether or not you want to go to the store or want to go out with your friends, definitely think about getting an assistive device. Nothing to be ashamed about, right? So obviously a cane is the first step that you would use, right? It's just a standard point cane or a quad cane, gives you that extra bit of stability there. Crutches is a little bit more for like a post-operative type of thing, post-surgical, where you got the axillary crutches, if you're non-weight bearing on one of your legs, or if you had a knee or a hip replacement. A walking stick. This one is usually pretty good, not something you see as often, but it could give you that extra bit of like a safety crutch, right? A walker or rollator, right? The walkers can either have 2 wheels or 4 wheels, and it's a little bit more stability than a cane. And then a rollator could be really good too. You've seen where it's got like the seat there. You can open up the seat, you can take a break, you can sit down. Really, really good. It's a little bit less supportive than a walker is, but it still serves the same purpose. Could be really, really good for keeping you from falling, right? Wheelchair is when it really, you're really having trouble with your balance, really having trouble staying up on your feet. Wheelchair, as we know, and then having a proper home setup. If you guys got stairs or curbs or ramps, having a cane upstairs and downstairs, or one in your car and one in your home, so that you have a good setup, so you can kind of go from assistive device to assistive device, right? Okay, go ahead, Bruce. Okay, good. This is my favorite slide here. Exercise, balance training, right? So we're going to go through a couple quick exercises that you guys can do to keep your balance muscles strong. And it's not just keeping your muscles strong, it's keeping your brain communicating with your body, called proprioception, where your body's at in space, right? So if you go to the countertop every morning, if you are doing a couple exercises, whether that be, heel raises or kicks, maybe do one leg balance, right? Maybe stand feet close together, right? Maybe stand one foot in front of another, right? With the countertop in front of you, or something really strong, right? These are great exercises to mix in. You could do it for 1 minute on each side, or just 1 minute total, and you'd be surprised the difference you would see in your balance, right? Just like I said, you can strengthen up these balance muscles and your brain communication with these muscles, okay? Having a good core strength and awareness, right? Making sure that you're using these big, strong muscles in your stomach, in your quads, and your glutes to make sure that you're staying strong on your feet. Using these muscles can be really important for preventing back pain, stenosis, neuropathy. Make sure that you're engaging your core no matter what you're doing. So if you're picking up a grandkid or pulling open a car door, you want to make sure you're using your big, strong muscles to protect yourself from any degeneration happening in your spine, your knees, your hips, right? So obviously important there. Stretching, love stretching, super, super important, right? Making sure you're mixing in some stretching with your exercise program could be ideal for preventing falls. Your endurance and respiration, you want to be moving, walking, body in motion stays in motion, so you got to keep it moving. All right, so working on your endurance could be really good too. And then physical therapy, right? So in my clinic, we do balance assessments and fall risk assessments. It's all covered by Medicare, and we kind of get a sense of how at risk are you for falls? Have you had a fall before? Physical therapists are always really well trained in balance and fall prevention, okay? And then Tai Chi, I'm not sure that, if you guys have like programs within the community here, chair aerobics, Tai Chi, but it could be really good to get involved in something like that, more of a group setting, right? So this is a really good one for fall prevention too, okay? Go ahead, Bruce. Okay, so we talked a little bit about medication, but we'll dive into it just in a little bit more detail here. Diabetes, medication, neuropathy, okay? So if you have, blood sugar really high, insulin resistance, diabetes, type 2 diabetes, you put you at more of a risk for falls. I've had people who literally get such bad burning, numbness, tingling in their feet at night, up in their toe pads, up to their toes. They can't even feel their feet hitting the ground. They feel like they got something in their shoes when they're walking, right? This sort of neuropathy as it relates to diabetes can really put you at risk for falls. You don't feel as much that sensation as your feet hit the floor. Can really affect balance, right? So something I often see and treat in my clinic is this sort of peripheral and diabetic neuropathy. Sometimes you don't need to have diabetes. It's kind of just, people suffer from these symptoms as we live longer and longer. So yeah, it causes this burning, numbness, tingling, decreased sensation. So make sure you're looking at your feet, doing weekly inspections if you're having trouble feeling down there, right? I've had people who come in with such bad neuropathy, they can have a tack stuck in their foot, not even know it. Their shoe could be rubbing on their foot the wrong way, and it could be cutting through their foot. They have no idea, right? So make sure you're looking at your feet if you have any of these sort of symptoms. It could be really important. Okay. And then we talked a little bit about mixed medications. You know, you get up, you get that bout of dizziness, or the way these medications interact in your body can really put you at risk for falls. So something to be aware of there. Okay. Also, chronic conditions, heart disease, Parkinson's disease. We talked about neuropathy, stroke, right? You get weakness on one side of your body, all quite common here. Cancer, radiation therapy can cause this burning, numbness, tingling in your lower legs and feet and affect your balance as well. Okay, diabetes we talked about, certain sleep disorders, right? All these things could put you more and more at risk for falls. Definitely some things to be aware of here. Chronic conditions and the medications prescribed to treat these conditions are really being shown to, cause people to fall. So, okay. We talked a little bit about wearing supportive shoes. Medicare will cover shoes that are really supportive, easy to put on. They got the straps, no laces, nothing like that. It's all covered. I do like these sort of Velcro type of shoe here. It has great support, great arch support, and can keep you safe on your feet. So also having custom inserts if you have flat-footedness, making sure that, you got good shoe wear to, if you are going to be going for a walk or going out in the community, so that you're keeping yourself safe on your feet. Okay. So supportive shoes, definitely something to think about if you know that you're going to be, doing more than you might be accustomed to. Okay. So it's always good to have a pair like this. Okay, we talked about having your vision checked, eye exams, having multifocal glasses can definitely throw you off, right? So, you look up, you look down, it kind of changes things. Then next thing you know, you're on the floor. You got to be real careful with those sort of things. Having eyes closed balance training, right? We talked a little bit about vertigo, right? BPPV, the crystals in the ears. This vertigo can really throw people off, cause this sort of dizziness, okay? Consulting with your optometrist for cataracts, glaucoma. These cataract surgeries are amazing anymore. You're in and out like this. Definitely good to get checked for these sort of things so that you are having your vision in a good spot to keep yourself from falling. Okay. All right. So we'll change gears a little bit here. We're going to go through a couple safety tips so that, if you do suffer a fall or if you are at risk for falls, then that you use these tips to kind of to prevent as best you can here. Okay. So keeping a phone near the floor or keeping your phone on you in case you fall and can't get up. I had recently a patient who came into my clinic. She was young. She was 70 years old, but she had a lot of weakness, right? She fell in her kitchen, lives alone, right? And was not able to get up on her own. It was 3 days she was lying on the floor in her kitchen, and where a neighbor found out that or saw that she hadn't gotten her mail and called her son, who came over to her house and found her. Thankfully, she was okay, but this is just a horror story, right? Not something you would wish upon anybody. So make sure that you're using these safety tips if you are at risk for falls, right? So that nothing like this happens to you or a loved one, right? So obviously they have these sort of life alerts now. They have these watches, these Apple watches that can detect when you fall. But having that sort of a thing could be really good, really, really good for preventing a horrible situation, especially if you're living alone. Okay. Keeping emergency numbers in large print so that if you are calling one of your kids or grandkids, you can have their number readily accessible for you. All right. Like I said, an alarm or an Apple Watch for emergencies, improved lighting. You're getting up to use the bathroom. You got to go down the hallway. They have these lights that have sensors now when you walk past them. Make sure you're putting yourself at an advantage, having good lighting at night so that, you can see where you're going, obviously. And so, these sort of like tap lights and sensored lights could be really, really good if you are waking up in the middle of the night to use the bathroom, for example. Keeping things moving. Like I'm going to continue to say, movement, exercise, balance, body in motion stays in motion. You got to keep it moving. That's really important for maintaining the strength that you already have now. And then using assistive devices if you really do need one could be really important too. Safety tips. Okay. Having a safe living environment. If you got hallways, stairs, make sure you're taking your time going up You're going up with your better leg, down with your worse leg on the stairs, having good lighting. Really, really important. Keeping your home clean, not a lot of clutter. Could be, you don't want to, catch your toe on something, or, you got throw rugs in your, or carpets, then you get your foot caught up under one. Next thing you know, you're all the way down on the floor, right? So having a safe living environment could be really, really important throughout your home. And then having a good walker or cane setup where you got one upstairs, one downstairs, really good tip if you are using an assistive device as well. Okay, so changing gears again here. So what happens if you do fall, right? Right comment again, what happens if you fall? So first thing you want to do is check yourself for injuries, right? Obviously, if you're falling, there's some parts of the body that are more vulnerable than others. But let's say you did have a fall, don't panic. Don't try to get up because you're embarrassed so fast, right? Definitely good to, accept kind of what's happened, stay on the ground, check yourself for injuries, make sure that there's no blood, nothing like that. And you can call out for help if you need it. But I've heard before, someone has a fall out in public, they try to get up on their own and they push up on a broken wrist or get up on a broken hip, they fall again. Things get worse. Okay. Take your time. If you do fall, kind of assess what's happened, accept what's happened, and call for help if you need. Okay. Seeking medical attention right away could be really good. I've had people suffer a fall. They think they're okay. 2 days later, they're like, yeah, wow, this is really, it hurts a lot more than I would have thought. Or, yeah, my hip is really bothering me now. They've been walking on a broken hip for 2 days, making it worse. Okay. So make sure that you're seeking medical attention right away. Oftentimes, even if you think you're okay. All right. Checking for other hazards, right? You fell in your bathroom, there's, water on the floor that you slipped on, you get up, try to get up again, boom, you're back down on the floor. You got two for one there. Not good. Okay. So check yourself for other hazards, look around, make sure that, you're taking your time and not putting yourself at risk for a second fall. Okay. And then learning how to get up properly. Oftentimes getting up from the floor isn't easy as you get older. So we'll kind of dive into that a little bit here, how to get up if you do fall properly. Okay, so first, how to fall safely. All right, sometimes you hit your foot on something, you're going down. There's those 2 seconds. You're like, yeah, I'm not going to be able to recover from this. My balance muscles aren't there. You're going down. Okay. And so there's certain things to keep in mind in those 2 seconds so that you're falling safely. Obviously, don't want to fall flat on your face, right? But there's certain things to keep in mind. You want to kind of stay calm, stay loose. You want to keep your arm and knees bent, protect your head and neck, obviously, and land on the more muscular parts of your body. Land on your back side or this like the middle of your back there, so that you're not falling on your outstretched hand or falling right on your hip. Then you end up with broken wrists or hands, right? Or broken wrists or hips. And you can kind of roll into the fall, right? I know that's kind of easier said than done. It's like when you were young, kind of roll right into it, bounce up like a rubber ball. But as you get older, it's important that you are protecting your more vulnerable parts if you're going down. Okay. All right. Go ahead, Bruce. So this slide, it's a little bit tough to read, but I'll kind of go through it quickly. I usually have one of my colleagues, she comes with me and kind of exemplifies this for me, but I'm not going to start crawling on the ground here. But so how to get up after a fall. Okay, so you fell, you checked around for hazards, you called for help, no one's around. What do you do? Okay, so first thing you want to do is find something to pull yourself up onto that's sturdy, right? Like a piece of furniture, a chair, stairs, something like that. Find something to pull yourself up onto. Okay. Then after you want to kind of get onto your side, roll your head in the direction that you plan to turn to, and then move your shoulder and arm, followed by your hip and leg, and kind of push yourself up into a kneeling position. Okay. So your other leg should be bent. You're kind of in like a half kneeling with one knee on the floor. Okay. And then you want to slowly push up from the floor from one knee and come and turn your butt over into the piece of furniture or chair that you're trying to get into so that you can kind of recover, take a second. Okay. I do have a video that exemplifies this in a little bit more detail that I can send you guys. So, it's really good to know how to get up from a fall, and that stopfalls.org website I talked to you about, that definitely shows a little bit more detail how to kind of get up if you fall, if you're crawling towards that piece of furniture, get onto one knee, push yourself up, move your butt over onto the piece of furniture that you're trying to get onto. Could be really good there. Okay, so go ahead, Bruce. I think we got to go one more. Okay, so what are the most common injuries that occur if you have had a fall? Foosh injuries, falling on your outstretched hand. Oftentimes you get like a radial wrist fracture, where you kind of got to get splinted. It's a really, really kind of a tough recovery there, and the wrist is kind of never the same after that. But this foosh injury, quite common. Broken hip, broken femur. I recently had a 90-year-old woman who fell and broke both of her hips at the same time. Miraculously, she was in my clinic today. I was treating her. She's walking now. She's got a cane. She's kind of like a really, good spirited person, and she's made quite a recovery, which was a little bit surprising. Oftentimes, 90 years old, a double hip fracture could be a little scary there, but she's motivated to do so, and she's doing quite well. Head injuries, very scary. Obviously, you want to protect your head and neck, but another common injury that occurs from falls. Certain cuts, abrasions, soft tissue injuries, pulled muscles, ligament injuries, all very common as it pertains to falls as well. So these are some of just the most common injuries if you did suffer a fall. Okay. Go ahead, Bruce. Okay, so some staggering statistics when it comes to falls, right? So, like I said, every 20 minutes, an older adult dies from a fall. So this is quite scary, right? So in the United States, very, very common. Older adults have twice the chance that have fallen once, double their chance of falling again, right? So if you fell once, your chance of falling again doubles, which is quite significant, okay? Very, very expensive as it pertains to healthcare, $744 million. This is a while ago, 2014. And 1 in 5 falls results in a broken bone or a head injury. 1 in 5 falls. So if you've had 3 or 4, 5 falls, it can be quite a staggering statistics there, where head injuries, broken bones can be quite scary. Okay, we'll shift gears one more time. So posture, having healthy postural habits can prevent common head and neck injuries such as spinal stenosis, radiculopathy, sciatica, neuropathy, right? Maintaining a good, strong posture, keeping your muscles quite strong, standing up straight. When you're in the recliner or at home watching the game, Monday Night Football tonight or something, you want to make sure that, you're not just slouching into the recliner all night. You want to kind of mix it up, stand up a bit, make sure you're kind of keeping yourself in a good postural position, keeping your core on, your shoulders back. Let's say you're at the computer, right? Compression fractures you sometimes see as people age. They kind of they're losing their height a little bit, or they're kind of getting more and more hunched over. Oftentimes this spinal stenosis, compression fractures in your lower spine can cause these sort of abnormalities as it pertains to posture. Okay. Go ahead, Bruce. Proper sit to stand. Love to talk about this one. Something we do every day. Muscles you want to keep really strong are your sit to stand muscles, right? So first thing you want to do is kind of scoot your butt forward, get your feet even, get your feet shoulder width apart. If you did have one leg that's stronger than another, you want to have that good leg, that stronger leg, back further than the weaker leg, right? Something to definitely think about. Use your arms if possible. If the chair has rests, engage your core. And then once you do stand up, take that 20 seconds, let your blood pressure normalize. Don't want to have that dizziness. You went to take the step too quick. You're moving too fast. No rush, right? You want to kind of take your time so you don't end up on the ground. All right. Move slowly and with control. All right. So we talked a little bit about some balance and posture exercise, single leg balance, narrowing your base of support, getting your feet closer to one another. Eyes closed balance training, tandem or tightrope walking could be really good. Tai Chi and chair aerobics, good kind of community group exercise activities to get involved in. And then my favorite is these side kicks, right? Kicking out to the side in a standing position like this strengthens up some of the most important balance muscles in your glutes, right? So If you're going to do anything, any exercise, make sure you're doing your heel raises and your side kicks and maybe a little single leg balance. All right. Takes 2 minutes. Mix it in. All right. So really good there. Okay. So, so kind of switching gears one last time here. Okay. So my name's Dr. Victor Alfieri. I own a small family practice right here in Somerset. I've been here for 1 year. My brother is the doctor of chiropractic, along with another colleague, Dr. Bill. And then my sister's a doctor of acupuncture, and that's what we offer. We have physical therapy, chiropractic, and acupuncture all under the same roof, right off Schoolhouse Road here. We're in that new kind of facility there off Randolph Road, on Randolph Road. Schoolhouse Pharmacy, who I know is another sponsor, along with my business here, AllCure Spine and Sports Medicine. They just opened a liquor store there right next to Summerfields. Okay, so that's where we're located. So again, we do physical therapy, chiropractic, acupuncture. So it's kind of this multidisciplinary treatment, and it's all covered by Medicare. Okay. Doesn't require any prescription from a doctor. You come on in, you get a fall risk assessment. You know, you don't need any sort of formal referral. You can come, anyone can come in at any time, direct access. Okay, so we have this kind of the 3-doctor approach, 3 disciplines that all kind of work cohesively to get you feeling better, right? Chiropractic, physical therapy, acupuncture, this multidisciplinary approach. If you're suffering from back pain, neuropathy, neck pain, just trying to get stronger, improve your wellness, improve your balance. You guys are paying for your Medicare, so you might as well put it to good use. Okay. So we do free fall risk assessments and balance training on the physical therapy side of things as well. Go ahead, Bruce. And here's just the kind of a picture of the building here. It's a new family-owned practice, where we separate ourselves from being a smaller practice from some of the more bigger hospital type physical therapy places that you might see. We separate ourselves through our kind of attention to detail, our one-on-one care each time you come in, manual therapy, stretching, massage, chiropractic adjustments, acupuncture treatments, all under the same, on the same day, all covered by Medicare. Okay, so right here on Randolph Road in Somerset. Go ahead, Bruce. So again, from your toes to your nose, we can help you with any sort of diagnosis that you might be suffering from, any sort of, if you, any of your wives or loved ones have any of these sort of symptoms, back pain, neck pain, knee pain, hip pain, this is right up our alley. We give free x-ray and free assessments. So from your toes to your nose, we could definitely help you within my family practice at AllCure. Okay. And I think that's it. All right. Thank you, guys. I appreciate you guys having me. I just want to say this community is very, very impressive. Alan and Vince have been very helpful in kind of getting my new business started here in the Somerset community. I have a lot of people and some familiar faces in here who come into my clinic from Canal Walk, and I'm very grateful for that. I know we'll continue to sponsor and be a part of the men's club here at Canal Walk. And I just want to thank you guys one more time. And if anyone has any questions, I'd be happy to answer. Or if you wanted to come and talk to me at the merch table, you guys can help yourselves and I can answer any more individualistic questions. All right. All right. Perfect. Thank you, guys. Sure. Go ahead. I'd recommend walking around the house with the shoes on, with those supportive shoes on, right? Sometimes if the floor is slippery, you got that extra layer of support. But, you know, if you know your home, you know where things are, usually pretty good walking barefoot anyway. But there's certain diagnoses like neuropathy where people suffer from that they don't like to walk barefoot. They like to have that extra little bit of support. So that's kind of why I throw that one in there. Yep. Yep. Go ahead, sir. Go ahead. Sure, go ahead. I'm all ears. Sure. Oh boy. Yeah. Yeah. Yes.
I don't have the route.
Okay, good.
Said that doc might on TV.
Sure.
Then fine, but my wife said they got something wrong and turn black.
Yeah. Sure. So as as you age, the heart and the blood vessels have more and more trouble sending the pumping the blood all the way down and all the way up from the fingertips and the toes. So if you are noticing discoloration, it might be less of something more nerve related, like if you got a nerve conduction test, and maybe something more cardiovascular related. Definitely something to look into if you're noticing discoloration. Venous insufficiency, quite common if you're getting swelling in your lower legs and feet. Oftentimes, if you're noticing discoloration in the toes, there's like an arterial insufficiency, which is something to definitely look into with your cardiologist or your vascular doctor. But if you are doing your foot inspections, as long as you got no open wounds, sores, anything like that, cuts, then you're typically okay. Check in with your cardiologist. I'm sure it's just something that, minor.
Second question that I have is that need to get L4 is what I'm talking about.
Yeah, I know. Yep.
L5.
Yep. Yep.
Okay, I had passed cortisone, whatever they call it, shots.
Yeah.
Spine. Because what I get is a numbness and a pain down the leg.
Yep. Yep. Quite common. Quite common.
Now, the doctor, the orthopedist doesn't want surgery because he said it would be very dangerous. I could end up not being able to walk at all.
Sure.
So they did every 2 years. I'll go for a shot. Fine.
Yeah. Yeah.
Helps that you would recommend something like that.
Absolutely. So, it does, yeah. Sometimes, so if you are getting, if you have a disc problem or stenosis in your lower spine and it's pressing on a nerve and shooting that pain down your legs, it's something I often see, and I often would side with your orthopedist to say, avoid surgery. Those pain management injections, epidurals, cortisone shots can be quite good for it, but that's where I come in within my clinic, right? We don't do any medication, we don't do any surgery, we don't do any needles, nothing like that. We get people feeling better and keep people feeling better. Discs have the potential to heal just as if you had strained your hamstring muscle, right? It heals up if you're doing the right thing. So through chiropractic adjustments, spinal decompression, which we offer, microvascular therapy, which kind of gets those nerves restimulated, and strength and exercise training, core strengthening, certain things. So if you have a disc problem, there's certain protocols that from an exercise standpoint that you might not be hitting that can kind of pull that disc back in, get the pressure off that nerve. So ultimately that's kind of right up our alley as far as like outpatient treatment. Yeah. Yeah, definitely think about, some outpatient physical therapy, chiropractic, and I'd be happy to, assess it and kind of get a real sense of it. Yeah.
About 6 years ago, a pandemic. It's on this medicine to get pain thing or whatever it was. And what it did was, all of a sudden, I don't know if you know what the ASD number is, the LSD number, which affects the liver, and went from like 68 to 586. So, of course, it's wrong.
Yeah, I think you'd be a good candidate for seeing us. Definitely grab a brochure. I have brochures, business cards, all sorts of more merchandise. I'd be happy to try to help you. All covered by Medicare. Absolutely. And no referral or script. Yep. Yep. All right. Thank you guys again. I'll be over here for a little bit. You can ask me anything over here. Thank you again.